Hi there. Meet our baby. This is Dr. Ochsner right here. Why am I holding the baby? There's a reason why. We are here today to discuss malpositions of the babies when we're talking about prenatal care, expecting mothers. You know, there's a lot of things to understand about this, some really good alternatives if you do have a baby with a malposition that we wanted to uncover for you today. So hopefully you find this video super impactful so that you can understand some of your options that are out there. Okay, so first I want to just kind of go over a little bit about what a malposition is when we look at the baby. And this, what you're looking at right here, is the actual ideal position. So as you can tell, the baby is head down like so. They call this occiput anterior. That just means the back of the head is turned forward. At least most of it is turned forward. Okay, so that's the ideal position. Vertex is the clinical term for that. But that's the goal. That's where we want the baby. So what can happen though is there's a few things. Breech is probably the most commonly referred to malposition that's out there, and there's different types of breech presentations, but the bottom line is when we're dealing with a breech baby, as you can see, the baby is no longer head down, the baby is head up. Okay, and as you can see, the legs go up like this because there's no room for them. They have to go up like that, and that creates a lot of spinal tension, a lot of spinal issues. In fact, I have a close family member who was breech her entire pregnancy, and then she has a very misaligned and malformed sacrum because of that process. So it's something that is definitely of concern for the future and for longevity, of course, as well. So breech is the first malposition we're talking about. Another one is posterior, otherwise known as sunny side up. So that's when, yes, the baby's head down, but they're facing the wrong way. So that's something to understand as well. And then the third one, also very common, probably second most common to the breech, is just a transverse, where the baby is sideways like so. Okay, so why does this happen? That's the big idea. That's the big question I want to answer. Many times, as you're going to see, it's due to this right here. This is I want to show you just a little bit of anatomy. So when you look at this spine right here, this is the lower part of the spine right here depicted. And then this is the uterus. This right here is called the round ligament. So that is the only ligament in the body, by the way, that has muscle fibers, and it will actually contract. So what can happen is when the spine is rotated, especially the sacrum, this lower bone right here, and when it's twisted one direction, and that puts the uterus into what's called uterine torsion. And this will also get tight, and those muscle fibers will fire, and we get trigger points and muscle spasm in that round ligament, either on one side or both, depending upon the malposition. So when we can address and move that sacrum, release the trigger points on the front, and allow that to relax, many times, as a matter of fact, over 80% of the time, we'll see that the baby will turn over all on its own. And I want to stress, this isn't obstetrics or the practice of medicine or anything like that. This is simply a biomechanical balancing of the structure of the expectant mom, and then the baby flips over all on their own. And if you think of the number of C-sections, I mean, we're over 30% births by C-section, many of which, almost half of those, are due to a breech or a malposition many times. We could avoid a lot of those in the future for many moms. So encourage you guys to always look at your options. This is something that we are also versed in. This technique I just went through is called the Webster technique. We do this at both of our locations, both of our facilities. If you or someone you know is affected by this and has a malposition, we'd be happy to check you out and hopefully get that baby doing the right thing, looking the right way. Thanks.